So we're back with some sobering statistics when it comes to women's health, specifically Black mothers. According to Johns Hopkins Bloomberg School of Public Health, Black women here in the U.S. are up to 3 times more likely to die from pregnancy-related causes than white women. So this disparity is often driven by systemic racism, implicit bias, and unequal access to quality care. And doctors say most of these deaths are preventable. So this is why we have a Black Maternal Health Week, why it exists, to raise awareness.
And joining us now to talk more about the importance of Black maternal health is Dr. Heather Benson from Community Health. Thank you so much for being here.
Thank you so much for having me.
This is such a reminder of how much progress we've made as a society, but yet how much further we still have to go. What goes through your heart and your mind when you see those numbers and the disparity that persists?
Yeah. Well, when you look at this Black Maternal Health Week, I see it as an opportunity to honor Black mothers, babies, families, while also giving us the opportunity to, be honest about the work that's still needed as we proceed in the state of Indiana. I think this conversation is so important because it just gives us the opportunity to get to the real underlying causes, right? Like you mentioned, access to care, access to treatment, equal treatment. A lot of these things aren't currently where we'd want them to be. And so it just gives us the opportunity to have the conversation so that we can work to improve these outcomes.
What have you seen in your own practice?
I think access to care is really the biggest issue. So we have women that are coming in to receive care later, and it's because whether they were working, they weren't able to get to the doctor's office. The hours in which, we would be open, they can't get out. It might give them a point or something that's going to affect their job security. And so, we just have to be more flexible. We've tried to do virtual care, and that's really made a big impact for us.
Well, let's talk more about that. In 2023, Black babies in Indiana were more than twice as likely to die before their first birthday than white infants. So what else can be done, do you think, to support Black mothers-to-be and then mothers in the weeks and months after birth?
Yeah, well, that statistic is a perfect one that you mentioned. When you look at Black babies and you compare it to non-Hispanic white babies in terms of the mortality rate, the white babies' mortality rate is 5.1. Black babies right now, it's 6.7, which is higher than just the overall average for the state of Indiana. What that means in real numbers is if you gave Black babies the same mortality rate as white babies, then 85 more white babies, or Black babies rather, would survive.
Wow.
And so that really just highlights the issue of we've got to do more. We've got to really try to hone on this issue. There are so many committees right now and organizations that are trying to look at coming up with strategies to improve these outcomes.
Yes, it's the mother's health, it's the child's health, they're all interrelated. And when we hear these alarming statistics, I heard you mention committees, but what do you feel like else needs to happen? These numbers are not necessarily new, though it's good we keep talking about them, but what else do you think needs to happen? And what would you suggest that mothers, everyday moms out there do?
I would say everyday moms need to really advocate for themselves, right? So when you find out you're pregnant, go and seek care. Don't wait for someone to call you. Go and find out, okay, this location, this hospital location is the closest. I'm gonna go there. I'm gonna tell them exactly what I'm feeling, all of my symptoms, all of the things. Don't hold back. You speak up and speak out is what I tell my patients, because when you speak up and speak out, you give us the opportunity to help you in any way that we can.
Speak up and speak out. Love it.
Okay, empowering women with information. Dr. Heather Benson, thank you so much for being here.
Thank you.
Thank you all for having me.